who's our newest addition, is already planning another trip. But, yep, everybody, I'd like to thank y'all for taking the time today. I'm going to ask everyone, starting with Blackwell over on the left, to introduce himself, working back to the right, and staff. We appreciate it. Everybody remember, try to do a better job with the microphones than I normally do. And if Mr. Blackwell, if you will start, introduce yourself and your district.
Thank you, Mr. Chairman. Bart Blackwell, District 81, Aiken.
Representative J.A. Moore, District 15, that's Berkeley and Charleston County.
Good afternoon, everyone. Cambrell Garvin, District 77, here in Richland County, covering Northeast Columbia and Blythewood. Great to be here.
Representative Kirkman Finley from here in Columbia, District 75.
Representative Shannon Erickson from Beaufort County, District 124.
Joe Jefferson, representing Berkeley and Dorchester Counties, District 102.
Good afternoon. Paula Calhoun, Lexington County, District 87.
And having successfully broken my mask already. At this point, I would ask Representative Erickson to open up with a prayer.
Thank you, Mr. Chairman. Please bow our heads. Heavenly Father, please be with us today as we conduct the business of the state. Watch over all of our citizens as they battle this unseen germ and virus. Be with them, strengthen them, fortify them, help us to be there in the capacities that we should help. Help our work today as in your will. Each day you help us. Thank you so much for the blessings. Let us find the silver linings in all the challenges that we face. In your heavenly name we pray. Amen.
Amen. Great. At this point, I'm going to recognize Sarah Hazard from the South Carolina Manufacturers Alliance.
Thank you, Mr. Chairman and members of the committee. My name is Sarah Hazard, and I am President and CEO of the South Carolina Manufacturers Alliance. Thank you for the opportunity to be here with you today. As I'm sure you all know, South Carolina's manufacturing sector has long been a key driver of our state's economy. From textiles to automotive, tire, aerospace, chemical, and others, our manufacturing industry has really developed a global reputation as a manufacturing leader, and we've experienced record growth in recent years. So it goes without saying that the impact of COVID-19 on the economy has been unprecedented. Never before has our state or our country seen such an extreme economic contraction in such a short period of time. In South Carolina, our unemployment rate increased from 2.5% to 12.1% practically overnight from March until April. So around 211,000 South Carolinians became unemployed during that 2-month period. Today, our unemployment rate still hovers around 12.5%. Manufacturing was fortunate that from the beginning of the COVID-19 outbreak, we were considered an essential business sector and remained open for business. Our state's manufacturing industry has a substantial impact on our economy in terms of its combined contribution to both our state's GDP and to our number of jobs. However, while manufacturing here remained open, there were manufacturing closures in other states and in countries around the globe that caused, and in some cases still continue to cause, supply chain disruptions. If you combine that with consumer demand being down, other business sectors being closed, companies dealing with employees who test positive, travel restrictions, and our state's manufacturing industry and our overall economy has taken a significant hit. So we as a state need to promote economic recovery as quickly and as safely as possible. But the question is, how do we do that? So from our perspective, one of the keys to jumpstarting our economy is to minimize the risk of liability related to COVID-19. Businesses need confidence and certainty in order to make a full recovery. We are asking for temporary and limited liability protection for companies who are trying to do the right thing by following public health guidance to provide a safe workplace. You know, we can take steps to mitigate the impact by following the recommended safety guidelines, but we don't want the COVID-19 situation to put companies at risk who are trying to do the right thing by operating safely, employing South Carolina workers, and rebuilding our economy. Another item that we are seeking is product liability protection. You know, at the outset of this pandemic, states across the country, hospitals, businesses, and others quickly recognized the short supply and critical need of personal protection equipment to combat COVID-19. Many of our state's manufacturers responded to the call and repurposed their operations or quickly ramped up their current operations to produce these critically needed products. So a temporary and limited safe harbor from liability for manufacturers making PPE is needed. We have been working over the last few months with both the House and the Senate on draft liability protection legislation, and we were hopeful that the legislature would take it up in June. But unfortunately, that didn't happen. So now we are urging the legislature to take the issue up in September when you all return again. Another concern our members have is the rising number of positive COVID-19 cases we are seeing in South Carolina. For manufacturers, safety has always been our top priority on a daily basis. So our industry has worked extremely hard to follow CDC guidelines and implement the highest levels of safety precautions in their facilities that they can. From hand washing stations to hand sanitizer, to temperature checks and social distancing, to plexiglass partitions and face masks and other face coverings. Manufacturers are doing what they can to follow the recommended guidelines in order to keep their workplaces safe, even if those guidelines have continued to change and evolve over the course of the pandemic. We have worked very closely with South Carolina DHEC and South Carolina OSHA to get the best guidance for our members. For example, DHEC has provided very specific direction for manufacturers that have a positive COVID-19 case in their workplace. And they've also provided us specific contacts at DHEC that industry can work with on any issues or questions that they may have related to COVID-19. So we have been very grateful for the support DHEC has offered to our members during this time. We also continue to hear from manufacturers about the critical need to reinforce to their employees the importance of COVID-19 precautions, not only inside the plant, but also when they leave work as well. Manufacturers across the state are working with their employees to encourage them to wear face masks when out in public and to take other safety precautions as well, so that we are all doing our part to combat COVID-19. Something else that we are following closely is the state's unemployment insurance trust fund. Following the Great Recession and the impact to the fund during that time, our state's businesses, through the unemployment insurance taxes that they pay, have worked over the last decade to rebuild our trust fund. Once COVID-19 hit and unemployment claims skyrocketed, the trust fund again took a substantial hit. Last month, we were very pleased and grateful to see the legislature allocate $500 million to the trust fund through the CARES Act spending plan. We are continuing to closely monitor the trust fund because even with the additional $500 million, we anticipate unemployment tax rates may still have to increase, and we are bracing for the impact that will have on South Carolina businesses. Finally, Representative Erickson, I will mention the availability of child care remains a concern for manufacturers. In addition to child care centers, as we continue to learn more about school reopening plans across our state and how they vary by individual school districts, we are closely monitoring how these various approaches will impact manufacturers, employees, and their operations. So in closing, I would say that I recognize that there are a number of challenges that I've mentioned today, but I want to add one more challenge, a challenge that could possibly resolve all of these other challenges, and it's not that hard to do. If we could ask every South Carolinian to commit to wearing a face mask when out in public for 1 month, we could help flatten the curve and significantly address these issues we are facing. From safety in the workplace to liability concerns, from our rising unemployment numbers to challenging the UI Trust Fund, and from child care availability to schools starting back, not to mention getting back to church and to our beloved football in the fall. Let's challenge ourselves and our fellow South Carolinians to wear a mask when we are out in public, for 1 month and end this pandemic's grip on our state once and for all. Thank you for the opportunity to speak with you all today, and I'm happy to answer any questions, Mr. Chairman.
Representative Moore.
Thank you so much for your presentation and for all the hard work you're doing on behalf of so many hardworking people. My question is, I kind of want to focus a little bit. You mentioned briefly at the end the child care piece. Can you kind of talk just in a little more detail from your alliance perspective, what would be helpful at the state level, what we could be doing to help alleviate some of the pain y'all experience or the perceived pain that y'all maybe experience as it relates to child care?
Sure. You know, I would say South Carolina did not shut down child care centers, as Representative Erickson, you well know, and we were grateful for that. So some centers were able to stay open, but many did close just because of the risks that were involved. And so that presented, and obviously when the schools closed as well, that presented problems for employees all across the state, trying to find child care alternatives, you know, so that they could go to work. As far as what the state can do, you know, I don't know. I think that what we can do all together is wear face masks and try to get rid of this pandemic. That's really the best thing I know to do, and I would, you know, welcome any other suggestions, but it is certainly a problem, and it's not just our industry, it's other industries as well.
Thank you, Ms. Hazard, for that update. Very informative. My question is, as the schools prepare for this fall with the new press announcement that came out yesterday, are our schools able to get access to the PPEs for our teachers and administration as we go face to face?
I know that we are working with the state to coordinate any PPE needs that may be there. We do have manufacturers all across South Carolina that are making PPE. We do have manufacturers that are actually supplying PPE directly right now already to school districts. So we're working to get that word out. If any school districts are having trouble finding certain products of PPE, we're happy to help coordinate that.
Thank you.
Thank you, Mr. Chairman. Sarah, thank you so much. All of our manufacturers, thank you so much. You guys have really taken a brunt of keeping the economy going and working as hard as you can. And yes, childcare didn't close because we wanted to be there to support all of you, and the governor recognized that as an essential service, just like you are. I would share with you, in case your folks don't know it, DSS has stepped up with some of the federal COVID money, and if you're an essential worker in the state of South Carolina, there are funds available to help you pay for childcare. So please, if your folks are not applying for those, make sure they do. Now, that doesn't help where we already had a severe deficit of childcare. They're known as childcare deserts in different places of the state, and that has grown. We're about at half capacity, I think, of childcare open in the state, which means about half the workforce can be somewhere. Mm-hmm. The problem with getting it open in that I'm seeing is to keep numbers at a very low, safe number to be able to social distance in those classrooms and let the staff and the children be safe in those environments means that you've got to run your full staff with half of the income. Mm-hmm. And that's just prohibitive to a lot of centers, especially our small ones, to be able to open the doors and pay the light bills. And DSS has set up different ways for parents to get funding, and that helps. They've actually helped the childcare centers with some of the different disinfecting stuff that you guys actually help provide to the state for essential services. But we've got to get it to the point where we can get the numbers down. So thank you for your mask comment. I know you're a mom, and I know you understand firsthand of how important it is we want those children to be safe. And the governor talked about choices yesterday. And I'm gonna brag on Beaufort County, they'd done that, already ushered that plan out on Monday. we're gonna all have to get together, and our manufacturers, with the PPE they're doing, but also the fact they're carrying the state and a lot of their tax revenue right now, and I do not take that lightly. So thank you for what they're doing, but please, if we can help be that conduit with childcare options that DSS has a way to help temporarily set up childcare in places that are not existing, or to help you partner with some that are already there, and so is First Steps. So let's open that conversation a little bit more and see if we can't help the workers who need to be on their jobs.
Absolutely, thank you for that.
Absolutely, thank you.
I believe that we have a question coming from Representative McDaniel. Do you have it yet? So if you don't, yes, I'm sorry, you have another question? Yeah. Please go on. Anybody else?
Go ahead. You go first. Now I want to just go back to the that child care piece once again, if we can, just because I just think, you know, I'm a small business owner. I just think it's just so important when we're talking about manufacturing, and we got Restaurant Association here too. I mean, it's just going to be super important that we get this right. You know, I spoke to DSS on the way up here, and from my understanding, that essential worker funds that Representative Erickson is talking about, the deadline to sign up for that for essential workers was, I think, May the 15th or something like that. And from my understanding, that those funds are going to run out in August, if I'm not mistaken. So, you know, I think as we're putting in recommendations that we need to really consider expanding that program for it and making sure that folks know about it more. Can I ask a question to you? Do you know anything more about that, Shannon?
What I would say is that the extension was federal funding. We do have federal funding that is left that we have not allocated yet. So DSS should, I believe, look very seriously at the groups that need this and perhaps assist in those areas where we don't have childcare reopening. I'm gonna knock on wood here. We have never closed. We've stayed open the entire time, and it has not been easy. It has been very difficult, and it has been one of the largest challenges of my entire life. I'm very proud that we have remained open, and we have changed every single working piece of the puzzle a couple of times, meeting best practices. But the smaller the center, the newer the center, it's harder to get resources. So we're gonna have to really ask DSS to step up again. They have done. They're gonna need to do more, because in the areas of our state that we're already in a deficit for childcare, it's only going to get worse. And if we're going to help families get back to work and families get back to school, I mean, if a family doesn't feel comfortable sending their children to school because they have a small child they don't have childcare for, then that may keep another child at home. So I think it's all piggybacked in there. So I think we should speak with the director and the Child Care Licensing Division and the governor's office and see if we can't see those extensions come into play on some of those things. It helps the families also right now, because hours are cut and one person's working, maybe another one's not. And if they're looking for another job, they can't even go out and look for a job if you've got your children at home. So yes, I think DSS might need to be a really big piece of the business support system.
Representative Blackwell, you have a question?
Thank you, Mr. Chairman. Sarah, thank you for being here. Good to see you. As you know, I'm a small manufacturer myself, so I can certainly appreciate what your membership is experiencing these last few months. A couple of questions for you. I certainly understand the liability protection issue and the importance of that as an organization, but I'm a little curious about the PPE liability, product liability protection. Is that for manufacturers that are outside their normal product lines and are producing PPE just during these times, or what's the rationale behind that?
I mean, generally, manufacturers that stepped up to make PPE during this time specific to COVID-19, we are seeking product liability protection. It'd be very temporary and limited to this current pandemic situation.
Is that because they're not used to making PPE, or because of the increased volumes, or what exactly?
I think it's a little bit of both.
A little bit of both, okay. And you talked about the impact on the economy and the unemployment rate. What has been your experience as far as your membership goes and manufacturers? Have, for the most part, have they weathered it pretty well? Do you have any data specific to the manufacturing community in terms of unemployment and that type of thing?
I can get you the exact numbers. I don't have it off the top of my head. We have had manufacturers across the state who have needed to temporarily close their operations. I believe most of them are all back up and running at this time, so that's really positive. But it really highlights the situation of the rising number of cases that we're continuing to see, and the importance of people, practicing social distancing, wearing face masks when they're in public. If you go into a manufacturing plant, there are safety precautions everywhere you turn. But if we're concerned about what's happening outside of the workplace. And then some of those cases sometimes are being brought back into the plant. So if we can do more to avoid that, I think it would certainly help.
Right, understand. And one final question. I'm just curious what your sense is of the manufacturing community in general in terms of their outlook on the future. I know you talked about demand, and obviously if you don't have demand, you can't produce. We've seen some fall off on our own demand. We've responded to that, but it seems like it's coming back, or at least it was, maybe up until we see this spike in COVID cases. So I'm just curious what you're hearing from the membership in terms of their general sense and optimism or lack of optimism in terms of the fall and going into the winter and going forward.
It varies depending on the company and the industry that you're talking to. I do hear some companies that they are seeing an uptick in orders and things are picking back up, and that's very positive. But they, during the first few months of this, they ran into some issues, so they're still recovering from that. So I think there is probably a positive outlook, but it may be a slow recovery.
Thank you so much. Appreciate it.
Mr. Chairman.
Yes, ma'am.
Representative Blackwell, the data for, and this is from from DO, the data on manufacturing is 19.2% of unemployment claims at their highest rate. So I think that's pretty significantly strong, showing that the manufacturers really did hold tight to keeping their services running as best they could.
Does that represent the unemployment rate among manufacturers or the percentage of
Percent of
people who
initial,
filed
percent of
claims?
initial claims filed.
Okay, so
So
that,
out of everybody that filed claims,
right,
they were 19.2% of them.
okay.
Other sectors. took
Other
a more
sectors were-
significant hit.
Yeah, our accommodation and food service took the biggest hit at almost 25%.
Which is what I would expect, okay. All right.
Yeah.
Thank you.
But for manufacturing jobs, which is a lot of hands-on, to have only 19%, I would guess that that's pretty strong for a state to have it, given the record numbers. Our comparisons from 2009 to 2020, 2009 being the recession, and now, for example, March 28th was 11,000 folks on unemployment in 2009, but 64,856 in 2020, just to give you a little bit of a reference of how difficult it's been.
Appreciate that, thank you.
Certainly.
Yes, ma'am.
Thank you to one of the greatest subcommittee chairs in the world. I was trying to listen as I was coming in, and when I read the information about the limited liability, I think that is absolutely wonderful, because we don't need a whole lot of frivolous claims coming in. And I want to thank you for the presentation. But the question I have, with most of what we're doing, we have the service providers on one side, and we have the clients on the other side. With education, we have the parents and children on one side, we have the education providers on the other side, and, trying to come up with a good balance. What consideration have you all given to those manufacturing companies that are not, absolutely are not practicing the social distancing, but the workers are still going, and you may have answered this and I apologize, but they're still going to work, because I've received a few phone calls, well, actually it was more than a few, and I didn't know what to tell them. You know, they needed their jobs, so they continued to go in, and they were, you know, definitely afraid, but they continued to go in. So how do we kind of balance that with the fact of people just filing claims because they have nothing else to do?
That is a great question. This legislation is not intended to protect bad actors. And if there are companies out there that are not doing what they can to protect their employees and keep their workplaces safe, then this legislation would not give them any protections.
Okay, would you be in favor of like maybe a hotline or something for those individuals to call? So at least someone can come in and check the facility out and have a conversation with the CEO or the president and try to get them on track. You know, we're not trying to put anybody out of business. God knows we need everyone. But just to make sure that those folk are protected as well.
I do think that the state, maybe through DHEC and the OSHA, South Carolina OSHA office, are already fielding any questions like that today. So I think that's available.
Okay, great. And thank you again for coming.
Yes, sir.
Thank you, Mr. Chairman, and thank you, Ms. Hazard, for being here today. I was talking to a constituent about 3 weeks ago who has a child that works in one of our manufacturing plants, one of our meat producing plants. And she was petrified because she said that her child disclosed to her that several people at her job were contracting COVID-19, and her employer wasn't being transparent with her daughter about it. And so there was an article in the state newspaper that addressed this, I want to say on July the 1st, that talked about the fact that there are gaps, is that we don't know how many, the percentage of workers at these meat packing plants who have tested positive, so we really can't gauge the situation there. Do you know if these plants are disclosing to the employees whether or not their line mate has contracted COVID-19 or whether or not there's an outbreak in the facility? And if not, do you know if we can work towards that happening?
So I know that DHEC and CDC guidelines have laid out how companies should respond if an employee were to test positive. And my understanding is that they are recommending that they do let the other employees that they would have come in contact with know. They do have to be careful about privacy issues. But they are supposed to notify the other employees that are around them that they may have come in contact with. And I'll also say that we have companies in this state that are doing incredible jobs with contact tracing within their own facilities and are really going above and beyond to really make sure, because the last thing companies want is a spread of COVID-19 inside their workplaces.
Thank you.
Yes, sir.
I'm asking a bunch of questions. I'm the new kid out here. Let me go back on something, and I hope I'm not being too controversial, but I just want to go back on something that you said earlier on about a month-long mask wearing, that we could do it outside of your manufacturing facilities. Are you suggesting that is y'all's position as an alliance that we should require that as from a state level? Is that what you're advocating for?
So we don't have an official position on a statewide mandate. We do know that local governments across the state are implementing their own restrictions, but as an organization, I think what we're just seeing is, you know, we are seeing the numbers going up. We are concerned about it, and we're just hopeful that South Carolinians will step up and all pull together. And we know that the evidence shows that if you wear a face mask, that it can reduce the spread of COVID-19. And so we're just hopeful that South Carolinians would step up and rise to the challenge. So no, we don't have an official position at this time.
If everyone else is, you know, I find that very interesting for you to say, because I was reading through the editorial page at the Wall Street Journal the other day, and the editorial page quotes someone who I think we could safely say does not sit on my political side of the aisle, Andrew Cuomo from New York. And I think this is very important because it's very interesting, because it in many regards doesn't seem to come in direct, you and the governor's experience seem to be tracking a bit differently. Ask New York Governor Andrew Cuomo. 6 weeks after Mr. Cuomo locked down his state, hospitals were still admitting nearly 1,000 COVID patients a day. Mr. Cuomo directed them to survey patients about their habits. Lo, nearly all the patients were unemployed or retired and claimed to be sheltering in place. Now, here's what I think is important. This is a direct quote. We thought maybe they were taking public transportation, and we've taken special precautions on public transportation. But actually, no, because these people were literally at home, he said. Much of this comes down to what you do to protect yourself. Government has done everything it could. Society has done everything it could. Now it's up to you. And what I think is so important that we don't forget, and it's something that you and I discussed last time, this has moved out into the public in a way that we will never be able to control it. I mean, it's a friend of mine in rural South Carolina went to see his doctor after contracting COVID, and his doctor said, you have to understand, it is everywhere. But what I'm concerned about is I hear you advocating masks. Masks are an add-on to social distancing. They are not in replacement, and they really are the only benefit that I've been aware of that they bring is for large droplets if you're under 6 feet. WHO just put out a paper discussing what is the aerosol effect. They don't really know yet. And if it's aerosol, it's going to be N95s that make a big difference. But here's what I think is so important is what Governor Cuomo came up with. Much of this is happening away from work, in private parties, private gatherings, and what individuals are doing in their own time. This is what we've got to be so careful about. If people want to wear masks in public, so be it. But what they do at home amongst friends and everyone else matters intensely as well. Because I think we all have loved ones that we treasure, that we worry about. And if we don't pay very close attention to that, we are going to see a second wave. And you and I discussed this last time. We have to continue to explain to people, wash your hands, stay 6 feet away, and you need to remain in well-ventilated spaces. Masks are an add-on, but those first three are what matter intensely. So I just think that is a very important statement from a very different political aisle with a massive database to look at. What we're doing is going to be a drag over the next 8 months because we've done it for 4 months. People are getting tired. But if you are counting on someone else to protect you, please don't. You're going to have to do it right yourself, and it's very hard to tell people, but I think it's going to become ever more apparent. So thank you for coming. Yes, ma'am, Ms. Bernstein.
Thank you, Mr. Chairman. You said this last time, and I agree with a lot of what you've said, but you continue to say that the mask is an add-on. And it's my understanding when I've talked to medical professionals is if everybody wears a mask, then the ability for the droplets to be transferred and the COVID. So I don't want to give the impression that this committee or you as chairman of this committee think that mask is secondary. It is of utmost and primary importance, I think, to social distance, but sometimes we don't have that ability to keep 6 feet, but everybody should have masks. It's a minor inconvenience for a great upside.
But what I want to make sure of is that people do not think wearing a mask obviates the need to social distance to the best of your ability. Because what I'm starting to see, even at restaurants or in lines gathering for restaurants, is people going back to getting in masks. I mean, it's just the human condition. People like to stand next to each other and talk. And if we don't keep standing apart to the best of our ability, masks, everything else we do, help, but it is really staying 6 feet away that drives it almost more than anything else we can do. Wash your hands and stay 6 feet away. Yes, sir.
I just want everybody to know that I think what has been said today is very important. and it's extremely essential that we do wear the mask, as you have said. But this whole thing boils down to common sense. I've got 3 children, and I have told them repeatedly, use your common judgment. If you're out in the open, if somebody comes up to you, and if you don't have a mask, try to find one or turn the opposite direction. Because this thing, you can't smell it, you can't see it, you can't taste it. So it boils down to common judgment, and that's all we need to do. That's the only comment I have at this time.
I agree with you in entirety, and everybody exercise your judgment, because if you get somewhere that makes you uncomfortable, leave, and it is hard. You know that person that you don't know very well that comes up too closely, and you start feeling now you're talking to them and you're backing away? I mean, you feel like you're being rude. It's not our natural condition, but it is so important, because there are just some people that can't seem to do it, but thank you. Oh, yes, sir.
I'm gonna stick on this mask thing real quick. You know, I got a lot of pushback when I got a lot of pushback in my district when I sent a letter to the governor about the mask wearing thing. And you know, I've talked to just like Representative Burns said, I've talked to a lot of medical professionals about it. And it comes down to, if I have a mask on and you don't, I'm keeping you safe, but you're not keeping me safe. And so, like Joe Jefferson said, I mean, we have to make sure that, you know, the 6 feet apart is important, but, you know, and I'm guilty of it. I'm a social person, and I think it's just hard for us not to take the position of making sure that folks are putting these masks on, because it's important. We got to get through this. I'm a business owner. Like, we have to get through this. Businesses are struggling. You know, working people are struggling. We got to make sure we're clear on wearing masks. Like, no matter what party affiliation you're a part of, we got to be focusing on that to get business back up and running.
Thank you, Mr. Chairman. Am I good?
Good afternoon, Mr. Chairman. The ladies, this is the trouble the ladies have, the earrings and the mask, and newfound challenges in life. Anyway, Mr. Chairman, thank you so much for having me today, and committee members. I am Rebecca Leach. I'm the Executive Director of the South Carolina Retail Association. So a quick summary of who we are for those of you who may not know. We represent retailers all across the state. Some have one location, some have multiple. Some even have locations across the nation and across the world. So we have a wide variety of folks that are members of ours. During the crisis, the members that would probably most stick out for you guys are going to be our grocers and our pharmacies, as well as some of our big box retailers and home improvement stores. So in South Carolina, the Retail Association employs 1 in 4 citizens, and so we have quite a large percentage of workers that are in our industry. And so during this crisis, as with any citizen in any business, there is not one retailer that was not affected by this crisis. Many remained open during the crisis because they were providing the essential products and services that folks needed. Some closed, maybe due to the governor's executive order or due to a choice for their employees. But those that remained open were faced with the challenge of figuring out how to navigate the ever-changing guidance and unclear guidance as they still continue to, again, remain open and provide these products and services. And so they were able to navigate, and I think they did a fantastic job and figured out what was the best practices to implement. And so those retailers that reopened after being closed for a while are able to use those best practices and employ those in their businesses, again, to protect their customers and to protect their employees. And they all want to be safe, and so you know, they face these challenges, but ultimately at the end of the day, they want to keep everybody safe. So we faced a couple, like I said, we faced a couple of challenges as we've navigated this crisis, and one is the liability protections that we're hoping, as Sarah mentioned earlier, that we're hoping that the General Assembly will pick back up in September. We were working since April or May to get those protections in place. Again, we want them to be targeted and we want them to be limited, but we want these businesses, these retailers who stayed open or who reopened and who are doing their best and implementing these best practices to be protected. These are not for bad actors. These are not for people who choose not to follow guidance. And so we hope that the General Assembly, again, will take that up when they return in November. Another challenge that our retailers and many of our businesses have faced throughout this crisis is the multitude of local emergency ordinances we've had to navigate. You know, as we know, most of the crises that we face in South Carolina are typically related to natural disasters, hurricanes, floods, even occasional tornadoes, unfortunately. But those are brief, and those are thankfully brief. And so whenever we do have these emergency ordinances and these emergency decisions, they happen in a very short period of time, and they last generally for a short period of time. We're in I think month 5 of this crisis. And so we've had continuous emergency ordinances adopted and enacted by local governments in order to address measures in their own communities, to provide protections for their own communities. Couple of challenges with that. So they have been vast. They have covered things from closing businesses to instituting curfews to requiring masks. And then now we're starting to see getting back into the businesses and prohibiting or limiting occupancies for businesses. And so over the past 4 weeks, we have seen a total of, I think today's count was 77 different mask ordinances and resolutions across our state. Now, thankfully, our state municipal association did a great job of creating a model ordinance and provided that to their members to use. Of course, it's a model ordinance and it's a suggestion. So some used it, some did not. They generally altered it to kind of fit what their council wanted to do. And the problem with that comes with trying to reach out to these folks ahead of time to hopefully help navigate and explain the impact of these ordinances on the local businesses. And as you are probably aware, with emergency ordinances, notifications and the amount of time required before a meeting can be held is lifted, and understandably so. When there's an emergency and you need to get things out quickly, I get it. You need to waive that 24-hour rule. But again, the problem is this has gone on for 5 months, and so we're constantly waiving that 24-hour rule, and so there's not a good necessarily notification for these emergency ordinances. So these businesses don't have the ability or the knowledge that these things are happening to address ahead of time, and so that's been a challenge for us to try to stay on top of that. And then the other really big challenge is when they do enact these local emergency ordinances, there's no central repository. So they enact them, and so it is. And so the best way that I find these is Google. I have to sit around and Google different jurisdictions in South Carolina to try to find them. And so that's really been a really big challenge for our state's businesses. Again, we understand the need for them, but it makes it very difficult to operate your business when you don't know what's happening and you don't know what requirements are out there. So our sister state to the north experienced the same concern with the multitude of differing emergency ordinances kind of popping up and not being aware of them. And so they've actually enacted legislation to help address that with a central repository. And that was just recently done, so we haven't seen the effects of it, but we think obviously anytime you have a central repository and a place where someone can go, a business can go and find out what's expected of them, that has to be a positive. So that's something we hope we can move towards in South Carolina. Another challenge for our businesses and our retailers as we've navigated this crisis is testing for those who either have symptoms or think they've been exposed. Our Department of Health and Environmental Control and our state healthcare communities have done a great job of increasing access to testing, as we have seen, obviously, throughout this. And so we are so grateful for that it is simple enough to find where a location is popping up in your neighborhood and to receive this test. The concern and the challenge is the delayed results. As we all know, it's generally 3 to 5-ish days, and so, of course, when you've been tested, the guidance is that you quarantine and you aren't around others, you don't go to work, and so you're asking the workforce to sit out of work for at least 3 to 5 days until they get their results. Again, understandably, But that is a challenge for us because we're reducing our workforce when that happens. I understand there are some rapid tests out there that you can get your results within a few hours, but maybe there's some challenges with the reliability of those. I'm not a healthcare professional, but that's anecdotally what I've heard. So, this is a challenge, an area that we would love to see some growth in and some opportunities in to maybe help keep the workforce from having to be out of pocket for so long. Another challenge that we've experienced, and luckily the governor greatly helped us out with this, but as things shut down in March, a lot of businesses moved to curbside pickup and home delivery of orders, and that was a really great option for folks. And luckily, many of our retailers already had that option available, so we were able to kind of parlay into that and use that more. Of course, it put a strain on the system because they weren't as prepared. They didn't have the resources available because it wasn't as used as heavily as it was at that point. But one of the problems, or one of the things that really identified during that time period, was you could do curbside pickup for all of your purchases with the exception of alcohol. And so if you wanted to purchase beer and wine, you could go to the curbside and get all of your purchases and then move your car and park and go inside and get your alcohol, which negated the whole process. And so the governor, in an executive order in March, actually allowed for curbside pickup of alcohol. And this also greatly helped our restaurant industry, which I'm sure John can, or the Restaurant Association can speak to this. But it allowed for the pickup of alcohol with your to-go orders. And since in-person dining wasn't allowable, that was a really, really, I think, saving grace for them to keep their businesses afloat. And so we've got that in the executive order that's allowable now, as long as we continue under the state of emergency or it's not, repealed or amended. We can continue to do that. DOR was tasked with developing protocol for that as to what was required of these businesses. They did a great job. We love the protocol they did. We think it's great. We think it's smart. We also know, again, this has been going on since March, that we haven't seen any incidents of issues with this curbside pickup of alcohol. It was almost like a pilot program for our state. And so it's worked out really well for our state. And so as we move through this crisis and even out of this crisis, we understand and we know that research has shown customers are going to really continue to use curbside pickup and delivery of their products. And so we think that it would be a great step for the state to codify what DOR has done and what the governor has done to allow for curbside pickup and even home delivery of alcohol. Last count, 26 other states, I believe, already have this permanently in their statute. It's already allowable, and many more are contemplating it. Since the crisis, most every state has allowed for curbside pickup of alcohol, at least on a temporary basis, because we've recognized the need. Again, you've got to be creative, and you've got to allow for the social distancing, and so this is one of those ways that you can allow that for your retailers. So we'd ask that the General Assembly please consider looking at that. And then vaccines. I know we're all very anxiously awaiting the development and release of a vaccine for COVID-19. Part of our membership, a lot of your chain pharmacies as well as your independent pharmacies are part of our organization. And then, of course, a lot of your grocery stores have pharmacies in them. So we do a lot in the pharmacy world. Currently, under South Carolina statute, we are allowed to administer the flu vaccine for folks of certain ages without a doctor's prescription. And so we would like to maybe look at how we can aid in the disbursement or the administration of the COVID vaccine when it is available. We know that it's going to be a challenge. We know that as soon as it's developed, there's probably going to be some protocol as to who gets it first, because we're all going to be clamoring to get it. But I do think that we already have the structure within our statute to allow our pharmacists to do that. We just may need a few little adjustments. So I think that's something that would greatly help our state and something for the General Assembly to take a look at. And then lastly, child care. Of course, it affects the workforce. And of course, again, they were not required to close. Some chose to, understandably, for their own businesses. But that is something that definitely impacts our workforce, and something that we keep an eye on, as well as the school districts announcing their plans. It's something that's going to greatly impact us, so it's something that we will watch. Of course, we want to see everybody get back to normal. We want to see kids back in school. We want everybody back to work, but we want it done safely. And so it's something we're definitely going to keep an eye on. And so with that, I thank you for letting me speak, and I'll be glad to answer any questions.
Thank you very much, Ms. Leach, for all of that, very informative information. The two pieces of legislation that you're asking us to consider, do y'all have the models from the other states? Or
Yes.
can you get that and send it to us?
Yes, ma'am.
Okay.
There's actually already legislation for the curbside pickup of alcohol already being contemplated by the General Assembly. So it is out there. But again, I think the Department of Revenue had created their own sort of, we're going to call it a pilot program under the governor's executive order. And we think that's worked really well because it's been tested already. So I think looking at what DOR has already done.
Okay, but in addition to that, can we get?
Oh,
North Carolina?
absolutely.
Okay, all right, thank you.
I believe as far as testing from the pharmacies, I think CVS and some of the other pharmacies are already testing now for the virus, right?
We are testing, yes, sir.
Yeah. And I think one of the biggest problems with the delay from people receiving their test results, they're not giving addresses and telephone numbers early enough so that they can receive a call to let them know whether or not they are positive or negative. Now, I got tested about 2 weeks ago on a Tuesday, and I got my call back that Thursday evening at 9 o'clock.
Right.
And my comment to them was, y'all are working 24/7, and they are.
Did they wake you up?
No, I don't go to bed until 12. But it was just amazing that they had called 9 o'clock at night, you know? But I think they're doing a great job.
No, absolutely, and please do not take my comments to mean they're not. Again, we are so appreciative of the access to increased testing, and that's so important. It's just as we move along and move forward with this, that's something that I know we need to look at is how can we get quicker results to not impact the workforce.
Thank you.
Yes, ma'am, Ms. Calhoun.
Ms. Leach, thank you for that presentation. I really appreciate it. Just, will you take a couple more minutes and expound upon the local emergency ordinances and the central repository? Just explain that just a little bit more, please.
Absolutely. So again, right now, whenever a local council, town, city, whatever county, enacts an emergency ordinance, they enact it, and then it's just, part of their code of ordinances. It is what it is. And so there's no requirement to notify the state that it's happened. There's, it's just kind of there. And so what North Carolina has done is they've partnered with I believe it's their Emergency Operations Center. So under EMD, we have our CEOC, our State Emergency Operations Center. And the local entities are required to report to their Emergency Operations Center that they have enacted this emergency ordinance. So therefore, there is a log of these ordinances. And so a business can go and say, could I see that list, please? Let me know what's happening. And so that would be the central repository I'm referencing.
Thank you. I would have thought this would have been in place already where there was a central repository for this, and thank you for that further explanation.
With this depository, are you asking to do something temporarily or just from moving forward?
I think it would be a great thing to do moving forward, because anytime there's an emergency, again, these emergency ordinances happen, and they're warranted and they're needed, but whenever the businesses don't know about them or can't find out about them, then it's a challenge. And so I think it's important. We experienced this during hurricanes. A lot of curfews happen, and I understand those are very specific to localities because the state's impacted differently depending on how the hurricane hits. So completely understand the need for those to be unique to the area, but I either have to call the location or Google a location, somehow try to find it, check Facebook, and that's just not effective for businesses. And so if we could have something, during an emergency that this is the process, that would be fantastic for business. Thank you.
At this point, South Carolina Restaurant and Lodging Association.
Thank you, Mr. Chairman. My name is John Durst. I'm President and CEO of the South Carolina Restaurant and Lodging Association. Members, it's a real honor to be with you all today. don't mind, I'm gonna sit here so I'll be a little closer to the microphone, especially since I'm a little raspy. Before I begin, I wanna say it's great to see both of you again. And, it's been really a blur since Accelerated SC, but thank you for your comments for what y'all are doing. I'm going to just set a numerical context for a few legislative items, which our board chairman, Bobby Williams, who is also the CEO of Lizard's Thicket here in Columbia, is going to share with you. I'll just begin by saying amen to what the ladies have already said and stipulate that they have very adequately, accurately described the situation here in South Carolina. So we'll just skip over all that. And let me just start internationally from a restaurant standpoint. I want to give you one piece of data, and that is that if you look at July the 7th of this year and go back to July the 7th of 2019, there has been a staggering 62.15% decline in the number of diners who have gone into restaurants over those 12 months. Furthermore, with regard to restaurant workers, over 8 million employees have been laid off or furloughed already, and 2 out of 3 restaurant employees nationwide have lost their jobs. It's nationwide. Also, nationwide in the hotel industry, as of July the 8th, nearly 6 out of 10 hotel rooms were completely empty across the country. And that is in addition to the literally thousands of hotels that were shuttered at that time. 70% of direct hotel employees have been laid off or furloughed, and hotel workers are losing more than $2.4 billion in earnings per week. Again, that's nationwide. Here in South Carolina, we have lost 58,214 total hotel jobs. Tourism Economics estimates that South Carolina has experienced a $3.3 billion loss in tourism revenue since the first week of February. That equates to a 49% loss of tourism revenue compared to visitor spending during that same time in 2019. As I'm sure you are familiar, the tourism industry in our state generates $23.8 billion of economic impact annually. Unfortunately, I now have to put that in past tense because that's what it has done. But also that past record, the tourism industry has been supporting 1 in every 10 jobs in South Carolina and generates $1.8 billion in state and local taxes. That was in the good days. Now, unfortunately, as we say, it's a very difficult and dire situation. South Carolina hotels experienced severe decreases in occupancy during the spring of this year, with occupancy rates falling as much as 71% in mid-spring. While some tourism business recovery has occurred in late May and June, statewide hotel occupancy remains substantially lower than the 2019 occupancy rate. Throughout the month of June, hotel occupancy rate was down by approximately 25%. In terms of employment, the leisure and hospitality industry has been the most affected sector in South Carolina, as y'all were talking in other contexts. As of May 2020, the number of leisure and hospitality jobs in our state is down approximately 34%. Y'all were talking about 19% earlier. We're down 34% compared to February 2020 or May 2019. This equates to a loss of approximately 92,000 jobs, accounting for roughly 44% of the total job loss experienced in our state during the pandemic. Just one final note, and that is it's worth noting that these revenues and job losses directly affect also the small businesses that comprise our tourism industry. According to the South Carolina 2018 Small Business Economic Profile, which is published by the SBA, South Carolina's tourism industry includes over 30,000 small business firms that provide employment for more than 153,000 South Carolinians. So there won't be a test on all these numbers, but we wanted to go ahead and set, as I said, a numerical context. Representative Exum, I want to specifically speak about your area. Yesterday morning, as I'm sure you're familiar, there was an economic conference down, which was sponsored by the Hilton Head Area Chamber of Commerce, and a tourism economics professor from the College of Charleston spoke. And what he said was, number one, that in Beaufort County, that y'all had lost $310.4 million between March 8 and July 11 in tourism-generated revenue. That's $310.4 million just during that period of time. By the end of April, there was an estimated 7,644 accommodations and food service employees in Beaufort and Jasper counties who had lost their jobs, according to that study. And so what this professor, whose last name was Gutentag, said was, tourism losses have secondary impacts also throughout the economy. The compounding benefits of their direct expenditures extend to every other economic sector of the community. So what that means, just drilling it down one step further in your area, is that overall the estimated tax losses are 14.8 million in local, 11.2 million state, 26.4 in federal. Tourism-specific taxes also have gone down 2.3 million in accommodations, 1.2 million in capital projects taxes, and 3.5 million in local accommodations taxes, plus 736,000 in local hospitality taxes. So that's where we are in South Carolina. It's not a good picture, to say the least. And so what we are here today is just to hit very briefly from about 2,000 feet some things that we think could be done. And we want to commend you all very much for what you are doing to look for reasonable, cost-effective ways in which our state can address these problems. One that I want to mention to you deals with what is called the ProStart program. ProStart program is a program that is available to the last 2 years of high school age kids, and also to some returning veterans and others who wish to start another career. It is done at high schools and other centers, development centers throughout the state. It has the goal of developing the next generation of leaders in the food service industry. It brings together the industry and the classroom, giving students a platform to discover and develop new interests and talents while teaching employability skills such as teamwork, professional behavior, time management, and communication. The program is run, as I say, through the National Restaurant Association, and we, the South Carolina Restaurant Association, in conjunction with the State Board of Education, manage the program here in our state. Currently, there are 49 schools across South Carolina, high school level, that offer ProStart. 10 of them are in the Midlands. Many of you are from the Midlands. So, okay, we're getting all these students trained through the ProStart program, but there's a problem, because in South Carolina, the culinary programs that are available to ProStart grads are available at the Technical College of the Lowcountry, Denmark Tech, USC, Spartanburg Community, Horry Georgetown Tech, Trinity Tech, Greenville Tech, and Clemson. There's one missing, the Midlands. We've been in conversation with the Midlands Tech folks, and what we're here today is to ask if you could consider putting on a fast track to assist Midlands Tech with offering a culinary program. And the timing really could not be better from this context. Our industry is down. We are already demonstrating resilience. We're coming back. When we get to that point, we're going to need those trained workers to step up and help us out. And so here in the Midlands, a large answer to that dilemma is for Midlands Tech to offer a culinary and management skills program. Bobby and I have had several meetings with them. They're very receptive. It's just frankly a financial thing, but they have even taken the initiative, they being Midlands Tech, of sending some of their faculty to the schools, high schools where ProStart is taught, and ask the students their level of interest in enrolling in such a curriculum were it to be offered at Midlands Tech. Strong support for it. All the boxes have been checked. So that's item number one that we wanted to respectfully submit to you. But now I want to turn it over to my distinguished chairman, who also served on Accelerate SC, and he can give you some firsthand experience as a restaurateur, and also by virtue of having served on the board of the National Restaurant Association, and being a whatever generation family involved in the restaurant business here in South Carolina.
Thank you, John, and thank you all of you for allowing me to be here today. Our deal was John would give the good news and I would give the bad news, so it's not going to be pretty. As John said, I've been in the restaurant business with my family here since 1977. My grandmother started Villa Tronco in 1942, so our family has really been in the restaurant community here for a long, long time. My father used to say as a joke when somebody asked him how business was, he would say, well, it started out slow and then it tapered off. That's exactly, that's not even fun anymore because it's the truth. You know, spring here in the Midlands, and I know a lot of you from the Low Country, spring here in the Midlands is the time when restaurants really do their best business because of the masters, because of high school and college graduations, weddings. It seems like ancient history now, but USC women's basketball was going to have a tournament game here, and all that got canceled. So, I mean, that's all business here in the Columbia area. On March the 12th, we started our social distancing on our own. On March 16th, the governor closed the dining rooms. March 17th, my business dropped 70%. Since then, for the rest of March, that was the middle of March, through the end of March, my business was off 30%. The good news is I made money in January and I made money in February, but March, April, we were off 40%. May, he opened the dining rooms on May the 11th. We built our business back up to be off 15%. I had to close 2 restaurants because of, number one, lack of employees. Number 2 is that catering business is gone right now, and there's one of the largest caterers are here in Columbia, Jimmy Stevenson, and he's a terrific reputation, terrific job. He told me he's canceled 300 events, and I don't know if any of you have had a wedding or whatnot, but the events are very expensive. My brother's son was getting married in April. They moved that to September. Now it's been moved to next April. The caterers are going to lose an entire year. So whatever I talk about the restaurant industry losing, the caterers have got it much worse. They're down 80 to 90%, and they're just doing anything they can. And they have been able, Jimmy has been able to find some business just to eke through, but it is absolutely horrible. You know, one thing that it's been a blessing, and it's also hurt us, is the federal unemployment. We are begging for employees. We're spending more money, and unemployment is what, 12%? We're spending more money now than pre-COVID for employees. And I have a very difficult time. I have a lot of people in entry-level jobs that are making $10 an hour, so they make $400 a week. They're home collecting $750 a week. I mean, I have a terrible time calling them back to work. And you know, if I do call them and ask them to come back, if they deny, then they lose their benefits. So it's terrible. It's terrible for them and it's terrible for us. I've got a business to run. I just can't do it to them until this money runs out. Maybe they'll do something else after July 1st. I really hope not, but there are certain segments of our industry that need that unemployment money still. All businesses, restaurants are not suffering right now. I mean, y'all can ride around, y'all can see, you can go to Chick-fil-A, they're up 20, 25%. McDonald's is at 90 or 100%. Rush's is over last year's sales. Anybody with a drive-through, the chicken chains are doing extremely well. Pizza delivery is up. So it's not every segment. The segment that are most of our members are chef owners / 100-seat restaurants. Their business, and if you seat 100 people, that means you can only use 50 of your chairs. Well, you never seat 50 people because you might have a table of 2 and a table of 4, so you might be sitting 35 people. Their business is over 60% off. My daughter owns an upscale restaurant. It's been horrendous. They closed for a month. California Dreamin' has been closed for several months. I think they're back open now, but I mean, if you take in consideration how much business has been lost by not being open, it's way over 60%. Many of these small restaurants will close. They estimate that 15 or 20% will close. Since July 1st, we have a lot of members in Charleston. Charleston is one of the top dining destinations in this country. They are down 60%. Unbelievable. They have some of the best restaurants in the country in Charleston, down 60%. Wild Dunes is closed for a month in July and August. It's just incredible. Myrtle Beach since July 1st is down another 15%. Those businesses, if they don't make it in the summer, they will not make it in the winter. Everything they make in the summer, it takes them to get through the winter. Greenville, down 60%. There's no business travel at all right now. He stole my thunder on the seating. The National Restaurant Association says that restaurants in the country have already lost $120 billion, and they expect to lose $240 billion by the end of the year. The South Carolina Restaurant Lodging Association, along with DHEC and PRT, developed the reopening guidelines for Accelerate SC Task Force. Also, we developed Palmetto Priority. I hope you've seen this on some restaurant doors. We did this to build confidence in our customers. That's what we wanted to do. We're letting them know that we're going the extra mile. We're wearing gloves, we're wearing masks, we're sanitizing. I'm not very familiar with politics, but when we left the governor, this barcode was not on there. So overnight, he put his barcode. So if you're in a restaurant and you do see something that they're not following the rules, you can barcode and turn in a complaint. It comes to the Restaurant Association. Right now, it's been overwhelming positive comments. So we're trying to do the right thing. Customers seem to, we're trying to protect our customers, and we're trying to protect our employees also. You know, at one time, there were 50 restaurants in Charleston closed. They would get open, have somebody get sick, and they close back down. I mean, there's 20 closed right now. The other good news I have is that we, through Accelerate SC, have worked with a lot of state agencies. They have been unbelievable. DHEC, PRT, SLED, DOR, Department of Unemployment and Workforce. It's been incredible. We call somebody, they get right back with us. They really have been partners of ours, and it's made a bad situation good. What can y'all do for us? We're going to need protection. There's going to be some COVID-19 liability lawsuits that absolutely they're going to be here. Liquor licenses, we have got to get out of the 1950s. We have several here. Well, first thing is that we want responsible alcoholic beverage training for servers. We're all for that. Caterers need to be able to have a license. Instead of an individual having to get a liquor license for one event, the caterers need to be able to do that. We need to change, there's no classification for a bar or a nightclub in South Carolina. The governor just had an order to stop all alcohol at 11 o'clock. When we left the meeting with him, it was everything, you couldn't buy anything after 11, but
Last call, yeah.
last call, but now he's changed it to no consumption, which changes it all. But we have some very responsible operators that social distance, but nightclubs and bars need to have their own segment. There's a lot of them closing 5 points because of the food minimum, whatever it might be. We would like to see that get changed. We are looking at some federal support right now. There's a Restaurant Act bill, $120 billion, geared towards small restaurants and bars. Also, another round of PPP for businesses that are losing money. the first round, you did not have to prove you're losing money, PPP money, and people got the money. This next round, it needs for people who are losing money. I think the federal unemployment, as much as I hate to say this, but there are certain businesses, live theaters, concert halls, convention centers, and caterers, they're not being able to do business. They might need some more help. And so I would like to see that continued. And that is all I have. If you have any questions, I'd be happy to answer them.
On the server training, one of the problems that I've been brought to is that it could be construed as creating a new form of liability. So would y'all support that it cannot be construed as a new form of liability or creating a new form of liability?
Yeah, the intent is to the contrary, but yeah, you start to say something.
But,
Well, of course we would do that.
Yeah.
okay, just checking because the law spent a good bit of time with the judiciary chairman.
Yeah.
And it creates a brand new course that could be brought to bear. But if y'all support the fact that it's training, it's not intended to create a new form of liability, because that's not the understanding that's been there in the past.
Yeah. And this is not mandatory for all servers, just alcohol.
Well, right, but I think the struggle was things like, for example, you get busy, busboy picks something up, hands it to the wrong person, and all of a sudden you've created a brand new form of liability. That's exactly the point. That I think what everybody's afraid of is that whether it be COVID, server training, et cetera, we're creating a brand new form of liability that comes back to bite people.
I know, but really our intent really is to make the roads safer. If you think they've had too much to drink, you should have the training and the ability to call the manager over and say, I think he's had enough.
Well, I think that exists, but I think the other problem is that, for example, in 5 Points, you look at it, how many liquor licenses have been pulled for either underage drinking or over-serving constituents?
Are not serving enough food.
Well,
Dick
they're now in
Arpullian,
court.
He's got every rent for lease sign in 5 Points right now.
But my point to you is they're being put out of business over an argument over your percentage of food, not over what we just discussed, which is making.
They're bad operators, but we want to get rid of the bad operators too.
Right, but SLED and ABC already have the ability to do that. As we sit here today, they've just chosen not to.
They have chosen not to.
There we go.
You're
We
right.
agree on that. Any other? Yes, sir.
I'll just make a quick comment as a caterer. And I've been in the industry for almost 20 years now. Made me feel older, but you know, I'll just personal testimony. I'm a caterer, and 98% of my business is based on airport travel, both in Charleston and Myrtle Beach through Hudson. And, you know, I was down in the height of the pandemic, which was still in now, 98%. I mean, you know, I went a whole month without any sales. So I feel the pain of all restaurateurs and folks in the industry. And I want to, if you could, just talk a little bit more about I think it's called the Restaurant Revival Act in Congress. Do you think there's a need to do something like that here in South Carolina? Do a kind of like a micro version of it here in South Carolina?
Of course. I mean, tourism is huge industry here. There's so many people here, small people. I don't know if we would make it for businesses less than 50 people or 75 people or something, but I think over 25 states now have started some sort of relief fund for restaurants. It would have to be, to me, proof of need, absolutely. But as you know, your travel might not get back up.
Right.
It might be months.
I mean, yeah, I mean, I'm really projecting next year.
Yeah.
You know, and we've had to get real, you're talking about getting creative with how we do business. It's been very interesting. You have to be nimble in times like these.
Well, and you know, and this, Accelerate SC talks, I know the state has gotten almost $2 billion and that they've already allocated most of it. And I don't know if they really look to the private sector for any of that money. Most of it was public sector and education, so.
Representative Moore, to your point, if I may, we just got yesterday a packet from the National Restaurant Association about the items they are pushing to be a part of the fourth phase of economic recovery. And one of them is to create a long-term loan program, which would provide at least 6 months of operating costs, including payroll, and allow for partial forgiveness, which is a revision of the PPP,
Right.
building on and learning from the mistakes that had occurred previously. I submit to you that we don't know whether or not that will pass intact or not. There's going to be a gap, and if the state could be of some assistance, that would be terrific on the loan program.
Do you, can I talk a little bit, this is kind of what I've been championing today, just because just all the conversations I've had in my district and in our industry in specific. Can you talk a little bit about some of the experiences your members have been having dealing with the child care piece? Because I think that's like the missing piece in, you know, especially with the uncertainty of in-person schools starting. And, you know, there's going to be a lot of parents, I suspect, that are going to want to do the e-learning piece. Have y'all had any conversations with members about that, worried about staff?
Yes, we have, and it does get right back to the question of when school starts. I mean, that's just, that's where we're at. Of course, the strength of our industry is part of it, and how many people we can bring on board. But it circles back to that which is in the headlines right now as to what occurs in that regard. And I, for one, am going to be very interested in see what, if any, recommendation you all make along that line.
You know, at the Accelerate SC meetings, there was a presentation by, who would that be? What agency is child care?
Yes.
And at the time, he had asked that the business community needs to get more involved with the child care to help them. And I thought to myself, I said, well, these people are in this for a profit, this child care. But after thinking about it, I said, you know what? If I could, if there's one in my area, which are my employees, I would certainly help in any way I could. And I think maybe we need to change our thinking about that, because we have got to have employees. And if they're going to be home with the children, you know what I mean? We're just going, it's just a vicious circle. And this crisis has got so many things going on that it's just hard to put your arms around.
Yeah, and then let me just say again with the child care piece, like, you know, as we, you know, my business, as I'm slowly trying to, you know, bring my employees back, that's kind of been a big piece. That I have like 2 or 3 employees now that have school-age kids, well, younger school-age kids, and they're just so concerned with the uncertainty of what's going to happen with schools, because most of the stuff that we do is from like 9 to 2, so, you know, those are school times, right? And so I think as an industry, we really need to kind of rethink, you know, our position on being a little more supportive of these child care facilities, because I think it's going to be key to making sure we come back strong.
I do want to interject. You're aware that with the CARES Act money, right now, I believe $500 million is slotted to go to unemployment benefits? To chop up the trust fund. That is a huge move by the governor to help all private business, because without that, what were the numbers we saw? 270, 300% increase without half a. I mean, so it is a monstrous, I mean, it's almost a third of the money that we're looking at, somewhere between 25 and 30%. That's a pretty good hit right off the bat just to try to help with that alone. So I think we just need to remember that while we aren't going to see that as a business, we're not going to pay it out over time.
Yeah, but still, I mean, as you go home today, go by the restaurants, everybody's got a sign out, help wanted. This is just the craziest thing. Here we are trying to get back to some normalcy, and we don't have enough employees.
Thank you, Mr. Chairman. the Technical College of the Low Country has a great culinary arts program, and I'm a huge fan, and we have one of the best technical college systems in the entire nation, if not the best. Are you using the new South Carolina Winds program, and do you know about it?
The answer is yes, but not fully.
Okay. Well, I would say I've been really pushing, and if any of my colleagues don't know about it, it's tuition assistance for essential workers, and restaurants, catering, they're considered essential, and there's some really big tuition dollars going for those folks to get retrained and retooled to go out into your workforce. Everybody in the world should have to work in food and beverage, at least for a certain part of their life, in my opinion, so that they will appreciate it. It will make you, you will appreciate your food, you'll appreciate the dining out experience, and you will tip better, and all of those things. And my family owned a restaurant, and I was the grunt labor, so I get it. Yes, the UI, the unemployment insurance, to have the $500 come off the top, the governor to do that, and then the General Assembly to pass it a couple of months ago. We don't need to revisit the years that we were all having to pay astronomical rates that hurt us each month. And I do believe that the food and beverage, you heard me cite the data. That comes out of my budget committee, which Michael Jackson over there and I work on together. So I'm really keenly aware of how badly you guys have been hit. I'm also in the Low Country. I mean, number one industry for us is tourism. So I actually started the curbside pickup and delivery Facebook page for Beaufort. And it went from like 2 members to 4,000 in 24 hours. And one of my local folks picked it up and said, Shannon, did you mean to do this? And I said, no, I didn't. I could use some help. And it's just been great because the restaurants have the outlet, they put their specials. We've had to really rethink and retool. So I hope we'll use our technical college systems, and let's push that out further. This committee's talked about some small business grants, some small business loans. I think everything's on the table right now, nothing is off the table, but we've got to look at how we make sure that those are accountable and you know, not a startup business that happened a month ago, but folks that have been in business for a long time and have paid into the South Carolina tax system and been part of our economic development, and help out where we can. And it is a dire strait that we are in. You know, school districts, they're going to be needing to use some of their reserve account money. I mean, we're in the middle of a rainy day. The good news is South Carolina is doing a lot better than the states beside us. So while we may all be floundering and trying to figure out how we deal with this, please know that on our end, on the Ways and Means Committee, which Cartman and I serve on, we're going to be doing everything we can to maintain those agency services for you. Thank you for saying the kind things you said about them. I know they have been trying so hard to be accessible and available and to help you work through those wrinkles that are new. But that's the other part of where we are. We've made some good choices of millions of dollars in reserve accounts, and we were having a really good year. Thank you a lot to the folks in this room from all of your groups that you've done. So we're not going to be in the North Carolina and Georgia right now are talking about 15 to 20% across the board agency cuts. That trickles down to you guys. So at least we're having some successes on decisions we've made before. You need to help guide us on where we go forward. Bureaucracy, I'm a small business owner and an educator. Bureaucracy doesn't know how you make your bottom line because theirs is an appropriation. Yours is sweat equity. So we appreciate you and know that we want to do everything we can to support you. So thank you also for your double service in Accelerate SC. I listened quite a bit in on those sections. And yes, thank you for also the appreciated child care. We've got to be a little bit more of a cohesive mix and support of that, and anything I can do to help on that, You've been in it for 20 years. I've got early education, care, and teaching now for 34. So yeah, I feel real old. But I've seen the evolution, and we can get it done, but we have to do it together as a state. And we've got good leadership in the governor's office, here in the House and here in the Senate. I saw that yesterday with education. So thank you, and we'll get it done.
Well, thank you. And to your point, if I may, on the child care, we alluded to it, but let's keep the door open to public-private partnership possibilities.
Mr. Blackwell, but I will say this, if you ever wanted some good experience with childcare, the South Carolina General Assembly is probably the finest place to learn that trade in the state.
Mr. Chairman, may I please? The only difference in my job at home and the job here is the people at home are supposed to act like 4-year-olds.
Yes, yes. We probably give 4-year-olds a bad name. Mr.
Thank you, Mr. Chairman. Gentlemen, thank you for being here. Appreciate the testimony. The numbers are staggering. What's happened to your industry is, I mean, it's just devastation, really, and I feel for you and your members. Sort of a general question, what, in your opinion, how would you rate, or what do you feel about the response from the government at the federal and state level? Do you think the industry has been unfairly targeted with closures and restrictions? Do you think it's been about maybe appropriate given the nature of the business? You know, I know you may not want to voice your opinion completely, but I'm just curious, what do you think? Is it too much, too little, too fast, too slow, in a general sense?
Yeah. And thank you for the question. I'll take the first bite out of that apple. I have at least every other week conference call with my counterparts across the country, and we talk about those kinds of concerns. And there certainly is a patchwork approach that is being taken across the country, and even within some states, with regard to the key issues, some of which you've discussed here today. There is a feeling that our industry, and I'm speaking nationwide, okay? There is a feeling that our industry, and that's both the restaurant and lodging side, has been looked on as maybe some low-hanging fruit to get some things, to make some things happen. But it also has been exacerbated. I'm gonna go on the other side now. It's been exacerbated because of how devastating we've been hit. And so that really magnifies the need that we have. And so we're therefore the squeaky wheel. We're making a lot of noise because we need the help. And so are we proportionally getting the help to the need? Probably not, because the need is so dire. And it's going to take a long-term solution, many different solutions, which y'all certainly in your infinite wisdom we're already discussing. If I could put on another hat, I'm also on the State Workforce Development Board, and we're talking about these same kinds of things. And so we look forward to collaborating with y'all in finding some joint answers. But specifically, proportionate to the need that we have, we probably are getting reasonable responses from the levels of government. But that doesn't mean that there can't be more done, and perhaps fewer regulations that are placed upon us. The old saying that I know we've all heard is that if you come to a compromise that everybody's happy with, probably both sides really are a little bit angry. And I think that's kind of where we are.
Right. Okay, well, thank you for that. You know, I guess many folks felt that this was going to be possibly a 3 or 4 month situation, and that we would eventually find our way out of it, push the virus, flatten the curve, all that kind of stuff, push the virus away. And it appears as though it's going the other direction right now. So we're going to be in this for the long haul into the fall and beyond. What else, I guess, can the government do other than extend unemployment insurance and a revised PPP program? Anything else you think that can be done? Do you think restrictions, and I'm kind of coming back to the restrictions issue again, do you think that needs to be rethought, or the closures need to continue because some states roll back some of the openings that they've already implemented? What are your thoughts in that regard?
Well, I really feel that we cannot afford to do another close down of the dining rooms, because the pipeline, the food pipeline right now is getting back to normal. it was empty for a long time. And not only do I have my business that I want to see do well, I must have 25 small businesses that depend on me. And when I don't buy from them,
Your
they were at
suppliers.
the verge of going out of business. So it's more than my business, it's everybody else that we help support. So I don't think, when we accelerate SC, when we close the dining rooms, you know, I got it from the coast, like, man, they just burned my phone up. We got to get open, we got to get open, we got to get open. We thought we would be open by July 1. I said, no matter what, we'll be open by July 1. Well, here we are. You know, it's going to be a while. I think it's going to be a while, and it needs to be. We've got to get over this. You know, the coast, this is their season. They've got to have it. And so we did get open, but nobody had a crystal ball. Nobody knew how long this thing would last. And we thought we did the right thing at the right time with the latest information that was out there. So everybody's pointing fingers now. Somewhere they said that the governor didn't listen to DHEC. Everything we did, we gave it to DHEC and said, we want your blessing. And then they blessed it and we gave it to the governor. That's just the way it went. It's easy to point fingers now, but we just didn't know what we were dealing with.
Mr. Johnson, you mentioned that you got a call back about your results at 9 o'clock at night or so.
Yes, sir.
I was talking to folks from DHEC at 9:30 some nights, so that's the kind of dedication you're seeing on that side of the fence. Mr. Chairman, if I could add just one other point to your list, and that's looking at a revision of the alcohol laws.
Duly noted, but I think that is I don't think that's gonna happen anytime in the very near future.
Yes, sir.
There-
It's long-term, but we wanted to just start the conversation.
And if you don't mind, Ms. Calhoun, I want to jump in real quickly. You know, I hear what y'all are asking, but we've looked at a small business minority focused small business plan to try to help really small micro businesses survive. But here's the math we're running into. $5,000, 20,000 businesses, it's $100 million. It's a lot of money very quickly. We are not going to be able to continue to see money, I think, flow because the numbers are so massive. Could be wrong. I mean, we spent $3 trillion in the first go round. You know, I think the thing that we are going to have to start doing is, I'm going to quote Mr. Moore, be nimble. I mean, you know, my restaurant's down 35%. Jimmy Stevenson and our partners, I understand exactly how badly the catering business has been hit. But we're not going to be able to make that up, unfortunately.
Oh, no.
And I think that everybody gets caught between the devil and the deep blue sea. I bet, 35% of your cost structure is employees and payroll? And then in a business like mine, I watched the price of beef in a 3-week period go from $3.30 a pound to over $6. I mean, on a 8-ounce burger, your cost of goods just jumped to $1.50. You can't raise, I mean, that's just on the beef. You can't raise prices fast enough to cover that. So I think we're all going to have to figure out what the new normal is. But what I agree with Mr. Moore on is we're all going to have to figure out how to get back to work, and whatever that looks like. It's going to be very different. I imagine catering will never look the same. The restaurant business, just where it is, do I think breakfast restaurants are coming back that are solely breakfast restaurants anytime in the near future? I think it's going to be tough, unfortunately. I think there are a lot of segments that are going to change dramatically. Talked to a friend last night. Pizza's up 40% year over year. Coming out, I mean, but that's going to be the struggle. But I think to expect that government is going to show up with a check, because I don't think Mr. Blackwell wants to write a check for Mr. Moore and I, but I could be wrong. Yeah. But thank you, Ms. Calhoun.
Thank you, gentlemen. I have restaurants in my family too. The Root Cellar and Private Property are 2 restaurants in my family. But the 2 questions I would like you to address, have the restaurant and lodging industries been able to access the small business loans? Are you hearing complaints that they weren't able to access it, I guess is what I'm wanting to hear. And the next question is, how has the supply chain from getting you the food and the products that you need, how has that worked during, and where is it now?
Well, we'll tell you this, the PPP, we were quick to get on that. What I found is if you had a CPA firm fill out your paperwork, it went through pretty good. If you filled it out yourself and made a couple mistakes, that just threw it back to the back of the pile. I hate to say that because my daughter did that in her restaurant. They filled it out themselves, they made a couple addition mistakes, and they did not get it the first time. Come to find out, they got the second time, which was a blessing because they were closed the first time, and now, you know, they could really use it right now. But so that's what I feel is that, and I had to call the banker several times. It's funny, my law firm got twice as much money as I did and faster. So, the supply chain is now coming back, but I still have, every time the truck pulls up, there might be 7 or 8 items that I have been able to buy for 40 years that are not available, and they said it will be after the first of the year, but it is coming back.
The supply chain is a very good question because that, you know, South Carolina is a string of small businesses. I mean, we have some big ones, but we are the majority small businesses. And one thing that we've touched on a little bit, and if we can't do as much money, the next thing, at least in my world, I mean, there's not much more regulated than childcare. I mean, people's children ought to be safe. People's restaurants, same way, ought to be safe. And I know the compliance is always the top of a good restaurant's gonna be one that has good compliance. I mean, it's just hand in hand. But that said, I'm sitting in the seat because some of the regulations that existed years ago when dealing with children sounded good on paper, but they weren't good in practice. Sarah can look at me and laugh and know, you know, ratios of children, seating, all those things, practical application. Same thing with the restaurant, right? So what I want to know is, are there regulations? Is there red tape? I hear the liquor stuff, and I am all about helping you with that. In fact, I got a text message from my Beaufort Area Hospitality Association as we're sitting here saying, Shannon, we really need to fix those liquor laws and keep the bad actors and reduce risk at the same time, okay? So I'm getting my little messages from those guys, and I got to give them a shout out. What can we do with the red tape? What regulations can we help you cut? Because the bottom line is we do have to be nimble, to borrow from JA, and we do have to change what we're doing. Supply chain, Beaufort County, farmed oysters, for example. An entire year's crop of farmed oysters that would ordinarily come out as single ladies, really pretty, select single oysters. Well, they sat there because none of y'all ordered them. Right. Because there was nobody to sell them to, right? So now that oyster grower doesn't have single ladies, he's rebranded them, and now they're fat ladies, which I happen to like a lot. And they're just as tasty, and the chefs are loving them. We've got to think on our feet. So what can we do to help you in those margins? Because the margins are very, very small. So what's costing you that we can fix while maintaining the safety and your business integrity of your personal models? That's really the meat of my wish today, is what can we do to help you with the overhead that the government causes you to have to spend?
Well, I've been in the business 40 years, over 40 years. DHEC right now is a whole different animal. They are our partners. I tell people that before, when DHEC came in the front door, we were running, trying to wipe stuff down and clean stuff. I mean, it was just a nightmare. Now, they use common sense, and what they do has just been incredible. If I think something's not right, I can call and talk to somebody, and we'll talk it out.
So
You
the
know,
gotcha's gone.
If you have 40 light bulbs in here, if 2 of them are out, it's a 4-point violation. Well, that's not worth 4 points, but they see that, they'll let you fix it on the spot. Now, if it's a violation that's critical, that could harm someone, they're gonna write you up for it. But right now, DHEC's doing a great job. Hugh Weathers, they just did commercials for the restaurant industry. He and PRT did that together. He's been at every meeting. He's doing everything he can. I mean, we want to sell South Carolina products. I mean, that's number one. And so I really,
Well,
I don't have a complaint.
You just let us know if there comes one that needs addressing.
I really don't have a complaint.
Yeah, and thank you. I want to also add to his list, they've come a long way. They being DHEC in uniformity of enforcement. It was different in different areas. We would get that feedback and you know, they certainly conceded that point, but they've done something about it. And so, we hadn't heard anything along those lines in quite some time. But to your last point, I wanted to respectfully, I was going to ask that anyway, was that if we could reach out to our members and see if there are any areas, regulation-wise, that could be brought to your attention, if that would be okay.
Welcome it, welcome it. I actually sit on the Regulatory Oversight Committee for the House as well. So would love to have that and be able to work through that with Chairman Huggins and the other members on that. Mr. Jefferson, no, are you? No, you're not on that.
Well, you know, when this first hit, I mean, restaurateurs were saying, I can't pay my sales tax, and we called, and he said, you know, well, take your time, you owe the money, but if you can't pay it right now, I won't charge you a penalty, I understand. I mean,
Good.
how
Well,
better could that be?
It's, look, it
We
makes
owe the
us
money.
happy, I'm sure, I'm echoing everybody's sentiment. It makes us happy when the agencies are being responsive and working with you, and that's what we would like.
The biggest problem right now is with, if you buy a liquor license for the year, even though liquor and beer is pretty inexpensive, I think way too inexpensive. Sunday sales, that's
Ridiculous,
ridiculous.
I know.
But you've not been able to sell alcohol for 4 months if you're closed, and you still had to buy that. If they could do something, and they have
They
given
extended
us
it.
Sundays,
Well, they extended, I think they added an extension for the period the state was shut down.
8 weeks.
Yeah, so I mean,
But alcohol, and you know that's a pretty inexpensive license. I can't believe how cheap it is.
but here's the other one. We're talking about nimble. We have a food truck. We probably have 10 or 12 municipalities and counties. We're filling out a different form to go to everyone. The requirements are different. It is, or we need to have a uniform exemption, which if you're not doing $10,000 or $8,000 or whatever it is in each municipality, you can fill out a common form. Because what we're doing right now is driving people that are trying to comply with the law out of the business. I mean, the most complicated spreadsheet we have in my office is to try to figure out how we deal with, you know, business license, H-tax in various cities and counties, in various cities, municipalities and counties. It just runs away from you. And I don't think anybody sees it. Nobody really wants to change it. But it's exactly like DHEC. You had one inspector that would come in, was focused only on refrigerator temperatures. Another one was there a bottle on top of a counter? And if you had a lid on it, some thought it was fine, some didn't. That's changed, but we've got to get business license to the same point. Because if we don't, it is going to kill the ability to be creative. I'll tell you the other thing, the regulatory structure where, you know, in New York City for a while, if you opened your restaurant, you were deemed to be in compliance and their inspecting body showed up afterwards. And if you didn't, you got fined. A friend of mine opening a 1,500 square foot restaurant in 5 Points got inspected 23 times. I mean, you just can't, you never get anywhere. No. So those are some city and municipal issues. At this point, if there are no more questions, I would like, yes, oh, yes, ma'am.
Thank you, Mr. Chairman. Fortunately or unfortunately, I'm not a business owner. But just listening to what all you all are saying is been very eye-opening. But I just want to make sure that we all understand that life sometimes have a way of making things happen and make us recognize things. And I consider myself somewhat a voice for the essential workers. My first question is, have you all heard anything, or is there any conversation about a walkout of essential workers here in South Carolina on July 20th? No, ma'am. Hadn't heard it? No, ma'am. Anybody else? You said, okay, well, it's out there. I don't know in South Carolina whether or not it's going to actually happen or not, but I've seen a lot of stuff on Facebook and different places about essential workers walking out. But I do appreciate the fact, if there's any good to come out of any terrible situation, is that we have learned how important those workers are. And we're realizing that even with money, if you don't have your essential workers, you're still at a loss. But I do appreciate what you all do for the industry and for people like me who do not like to cook and don't cook. I told her one of the worst things I had to do during this pandemic was eat my own cooking. That was that was not good. But also, I don't want the people who receive the unemployment to feel that they're being somewhat beat up on, because they did take advantage of an opportunity. In some cases, as Liz Graham got beat up for saying, some of them did receive more money in unemployment than what they received if they was actually working. But we also got to recognize and realize that government, you know, we bailed out the automobile industry, we bailed out banks, we bailed out others. So I just want to make sure that in what we're doing and what we're offering up, that we do not forget the people at the table whose voice oftentimes is not heard. And that would be our essential workers. And with that, one of the questions I have, question I have now is, when it comes to the protective equipment, have you all found any instances where the restaurants have run out of the protective equipment, or employees expected to bring their own protective gear?
Early on, I talked to one of the owners of Chick-fil-A, and they provided everyone with masks or face coverings, and they weren't comfortable. And so Chick-fil-A said, you can wear what you want as long as it's tasteful. Okay. Well, we provided everyone masks, but if they find something that works, they can wear what they want.
Okay.
I just got notice that gloves and PPEs are going up 60%. So we're paying, I can't, you know, we used to have green beans. We buy a lot of green beans. I must have 50 cases of green beans at a restaurant. Now I got 20 cases of gloves and hand sanitizer, you know. So all that is going up, and I think 60%, somebody needs to look into that, because it just sounds like it's a little price gouging to me. But I just want to say, on these people receiving this $600 federal money, here's where the disservice is. They got to pay tax on that next year. I don't think they have any idea. They don't have any idea, and nobody's saving any money. And they have, you know what I mean? You're going to hear some screaming next year when the tax bill comes due. So,
Maybe Donald Trump hear you, and he'll make sure that he used that towards his reelection. But anyway, thank you so much for that. And I just wanted to just be a voice somewhat, you know, for those individuals. And, you know, all my empathy goes out. One of my, in Fairfield County, one of our restaurant owners, she reopened yesterday, you know, for the inside. And, you know, your heart just goes out when you go in the restaurant and you see all these tables marked off, you know, as though there's, you know, caution, can't sit here, every other place. And it's just a time. It's just a time. But just as you asked us to introduce legislation, make sure that, you know, you ask us to consider. And even if it's just the protective gear, making sure that we can help you guys out with that, then please do so.
Absolutely. Thank you.
Yeah.
Thank you.
One other question I was wondering, you know, I have a catering company. I haven't been operating a restaurant in a couple of years now. Can you, on some of the guidelines that that restaurants are following now, tell me what your thoughts a little bit on this. And I get confused by this sometimes. A lot of restaurants are saying, okay, when you walk into the restaurant, put a mask on, and then once you sit down at the table, the bar, you can take your mask off. To me, I feel somewhat concerned about that, because then you have either your bartender or your server come to the table, and then people aren't wearing masks. It almost seems counterproductive.
Yeah, but they're wearing masks. I mean, the servers are wearing masks.
But what about the people that are sitting down? I'm thinking about the employees now. You know what I'm saying? Like, the employees I talked to several employees about that. So remember, me wearing a mask protects you, right? But if you don't have a mask on, you're not protecting me. So I'm concerned about, I don't know what the answer is, but have y'all thought about that? Like, because most of the time they're not within 6 feet. If they're serving a table, they're right up on a person, and the diner doesn't have a mask on. Have you thought about that?
I don't know how you can
I don't either. I just was.
communicate, or even, you gotta take it off to eat.
Yeah, it's complicated.
This goes back to my point, is that we've been talking about, we've got to make sure that people understand, because I ran into this when we first had our first employee test positive. And we thought we were gonna have to shut down because we were told anybody who had been within 6 feet of that employee. And we said, it's everybody. Right. And literally worked through it with DHEC, spent 2 hours on the phone, but the caveat is, it was, within 6 feet for 10 minutes. That number's now moved to 15. What I can tell you is that, and obviously our data set is far from perfect, it's more anecdotal than evidential, but where we are seeing cases come through are just like the quotation I read you from outside coming in. Now, where do I see problems? It's really less with interaction amongst, with the customers. It's more like you two gentlemen are doing. 2 of my employees sitting in the back, talking to each other for 10 minutes. That's where I worry about the problem more than anything else. Guys go out on smoke break. And there isn't a good answer. Now that they've moved it up to 15 minutes, we've kept it at 10, but I'm just running around, I feel like chasing chickens. Right. Stay away from each other, because if you get within 6 feet, that's where the danger zone happens. So.
And a lot of the restaurant infections are employees that get off work and they all like to get together and have a drink, and one thing about closing bars at 11 o'clock, restaurant employees enjoy going out after work, having a drink, and they're good tippers. So the restaurants that are open, they're really missing it because it's very profitable and they're good tippers. And one other thing about masks, New Orleans is famous for drive-through daiquiri places. And the masks in New Orleans, they all have a straw slot in them for daiquiris. So.
Which defeats the purpose, So
somebody's thinking out there.
Well, at this point, if they're, yes?
When we talk about the protective gear, the gloves wearing, some people think they can wear the gloves and they can just touch anything else. But if you work in that window and you have gloves on and you taking money and credit cards and other transactions, and if you reach over and touch something, so I don't know the guidance or whatever, however we can make sure that the restaurant owners know, because I tell you, when I drive up and that happens, I just drive off.
You would go through.
Gloves are the worst things that have happened to the restaurant industry. They are not sanitary. You can still touch your hair and wear your gloves, and you wear them all day long. They're supposed to be single-use gloves, but you would have to have 55-gallon trash cans to put them in, because there's just no way. Nothing takes the place of washing your hands. Nothing.
Well, really, nothing takes the place of being very careful where you put your hands.
I know, but you know what? How many times do we touch our face before all this? 50 times a day we touch our face. But we don't even think about it.
Right. But don't get, I'm not gonna say it, but my point being that whether it's gloves, we have got to get people focused on not getting in trouble, because it's coming. Yeah, it is. Thank you. Yes, ma'am. At this point, I'm going to read what Michael told me to read so that we can have a good meeting.
and I'm gonna go verbatim. When we get to future committee plans on the agenda, please ask for all recommendations from the committee members to be sent to staff next week. We're gonna say Michael specifically. And we will meet the following week via Teams to adopt those recommendations. Does that work for everybody? So I think our goal is to try to have this wrapped up the last week of July. Is that great? Any questions, calls, concerns, please let us know. Thank y'all.
Thank you. Thank you all.
Yep.